So let's talk about a few terms we're going to come in contact with here. One is mobility, and mobility is actually the ability to move or to be moved freely and easily. So yes, we need to have mobility in order to actually teach it to have stability. So stability comes after mobility, right? So if you think back to babies and infants, they've got a lot of mobility, right? We all started there, but they had very little stability and even worse motor control. They were just like total chaos on things going. But mobility without stability is extremely dangerous, in my opinion. And mobility without stability leads to a lack of mobility again, or what they call too much stability. So if something doesn't move, it's stable, correct? So a lack of mobility is too much stability. But you'll have too much stability in one place because you don't have enough stability in another, or what we call a motor control or a pattern. So stability is actually the resistance to movement, preventing movement. And when you look at movement dysfunction, you can have too much movement or you can have not enough movement. You have to have this nice balance in between the two, right? This yin and yang. And so that circular flow of balance through movement, which is the key. But the biggest one is a motor control, right? And I've said this in the past, and I'm going to keep saying it over and over and over, but it's your body's ability to sequence it and pattern it and timing it in the environmental situations that you're in that can determine whether you're actually mobile or stable. And that comes down to your nervous system, right? Your brain and how its ability to communicate with the body through feed forward and feedback mechanisms. So then we're going to get into what's called synchronization. Synchronization is all about timing. So you lose mobility if you don't have adequate sequencing and timing. And that's going to come from the brain and your nervous system communicating with the muscles of your body to keep those joints nice and centrated. So for me, everything's going to come down to a timing issue or a synchronization issue. So motor control, by my favorite definition, is from Anne Shumway Cook, and I've said this in the past as well. But motor control involves the way in which the central nervous system organizes muscles into coordinated movements. So you have something that looks efficient. It looks like there's a flow to it. It's not just haphazard flailing around like a kid on the ground. Sensory information, and that's the most important one in here. Sensory information is used to select and control movement, and movement patterns are influenced by perceptions. So sensory input is the key because when we see motor, we often forget about the sensory input. And that's where you're going to see coming up in a moment with using tape, using some soft tissue instruments to stimulate the nervous system, and then also using a lot of the ground as feedback to your skin to give you a sense of stability and motor control to help your perception of being safe, being stable. All right? So stability always precedes force production, and that's from Paul Chek, one of my favorite people to follow, Chek. So in order for you to generate power, you have to have stability, correct? But if you have too much stability, you also can't generate a lot of power. So you need to have this balance that we go. And Paul Chek even says, is that, if you try shooting a cannon out of a canoe, if you're not stable with a stable base, you're not going to generate that power, that potential strength that is always there. So where we're going to look into tapping into stability is a lot with the fascia, because 40% of a muscle force transmission is due to fascia, and that's from Carlos Stecco. So if you want to generate power and you want to generate force, that's strength. So to me, stability is force control. So is strength. So if I can tap into the fascial transmission across the slings and subsystems, then I will inherently make you more efficient and make you more stable, thus making you stronger as you go along. So let's talk about the thoracolumbar fascia as it's part of the system called the posterior oblique subsystem. And you know that I speak about this in great detail. So here, you're going to see an artist rendering of the three components of the posterior oblique subsystem. You've got your glute max, you got your latissimus dorsi, and your thoracolumbar fascia. So these subsystems were founded by Andrew Vleming, Vleming, and he has been a guest on my podcast, the Stop Chasing Pain podcast. I highly encourage you listen and follow that podcast, and he will talk about it in great detail. But you can see that these are going to form this X pattern across the body like this. So you got a right one, we name it from the shoulder. You've got a right posterior oblique subsystem, and you got a left posterior oblique subsystem. And they crisscross right here in the back, and this is called a fixed point axis of rotation. And they call it a punctum fixum, or a fixed point. So this is where power generates from along the X that's here. So you can see the fiber orientation looks very similar, right? So it's almost like a single muscle that the brain is looking at here, because the brain doesn't think in individual muscles. It only thinks in patterns. So the thoracolumbar fascia will be the linchpin between these two. So that's why if you see how force gets transmitted and dispersed and generated and absorbed from the ground up through the body, into the hip, and out through here, and then out the opposite arm. So if you have pain anywhere in your body, we need to look at this central point of axis of rotation. Can it be generated from here efficiently? So I'm going to look down here at your Achilles heel, and I'm also going to look up at your body's ability to transmit force across there with the thoracolumbar fascia. So I'm always going to treat both areas. So the takeaway from this webinar right now is that if anything hurts in the body, I don't care where it is, I want you to do what I'm going to be showing you for the thoracolumbar fascia, because in my clinical opinion, it's going to be involved. All right? Because Achilles tendonitis, as an example, is extremely difficult to get rid of, because the Achilles tendonitis is just a symptom. The diagnosis is not the symptom. So there's another representation of the slings of the body. We have slings in the front, we have slings in the back, and I show you on the primal movement change videos and stuff of how to assess these, and there'll be a lot more of these coming for looking at rotation. And these are pictures represented from rock tape that were done by permission from Thomas Meyer's performance lines. So you've got a posterior oblique sling on the left, and you got an anterior oblique sling on the right, and they have to work together. So this one you're going to see again, we name it by the shoulder. You got the left posterior oblique subsystem going from the left shoulder across the thoracolumbar fascia to the glute, and then you've got a right one, right lat, thoracolumbar fascia, left glute. And then you also have an anterior oblique subsystem in the front that goes from your pec, your abdominal region, to your inner thigh on your adductors, and we name this by the shoulder. So you have the right one, and then you have the left one. So whenever you're going to work with rotation in the subsystems of the body here, these have to work together. So when you come forward with your right arm and you punch forward with your right arm, you're shortening the right anterior oblique subsystem, and you're bringing the left arm behind you, and that's shortening the left posterior oblique subsystem. So the right anterior works with the left posterior, and the left anterior works with the right posterior. So they work together to generate torque, rotational torque. So now you can see some pretty cool stuff here from different pictures, and the one on the left is from a cadaver, and I think it's absolutely gorgeous and brilliant that you see just the magnificence of the thoracolumbar fascia tissue, and you can see the fiber orientation here. So it's quite large. And you can see a caricature drawing over here of the white stuff. It's just the mesh of fascia as it goes in between. So it's a huge amount of thoracolumbar fascia that's going to be coming across and attaching into that glute max TFL region here. So it's going to go all the way down this way, like a beautiful line of connective tissue. And in the middle, this is very, very important, because this is the stability complex in the lumbopelvic hip complex. So it's the lumbar, the pelvis, and the hip. You've got two ways to maintain stability in the lumbopelvic hip complex. You've got what's called form closure and force closure. Form closure is how the joints articulate with each other, how the femur head goes into the ilium, also how the sacrum articulates and locks in with the ilium and all the vertebrae. But you also have force closure. Force closure is represented by the long arrows this way, and force closure is from muscle, fascia, and ligament. You need to have both of these working in a balanced situation. So what happens if you have force closure dysfunction? Force closure dysfunction can be Maybe you've got inhibition in your lat, inhibition in your glute, you've got tight fascia, so you have an inefficient force closure mechanism of stability. Then what happens is your body and your brain now fall back on form closure stability. So it actually jams your pelvis, your hips, and your lumbars together to gain stability. So the lack of mobility is actually from a lack of stability, right? So in order to bring this back, we're going to have to give you mobility in your joints. So we can do that through here, and we got to give you mobility through your fascia. But then here's the most important part. We actually have to teach your brain, we have to teach your nervous system how to control it, how to synchronize it, and how to repattern it. And synchronization is the key because the brain doesn't think in individual muscles, so isolated muscle stuff won't get you very far. We have to synchronize tissue that we release with the rest of the body. That's what synchronization is. Think about full body, graceful movement and flow, right? So a few anatomical things about the thoracolumbar fascia, which is very cool. I'll let you read through this if you freeze it when you're going through the slide, but of special note is the bottom one, that the internal fibers of the thoracolumbar fascia also attach to the posterior fibers of the internal oblique and the diaphragm. So they're going to play a role in establishing intra-abdominal pressure. Intra-abdominal pressure is the powerhouse breathing mechanism of the inner cylinder for you. And if you don't have that, you have a loss of stabilization. So I actually do, in my opinion, include the internal obliques as part of your deep, fundamental, intrinsic core. So if you have a diaphragm breathing problem, you also have a thoracolumbar fascia problem. They consider the thoracolumbar fascia as your diaphragm of your back because that needs to expand when you take a nice deep breath in. So if it's clamped down and restricted, you're not going to be able to breathe and expand in a 360 cylinder efficiently. So this is from a presentation that I saw with Dr. Warren Hammer, who's a very brilliant chiropractor and teaches a lot of fascial manipulation. And it's very interesting. You see here, I'll look at the third line down. Mentz's 2010 found that 90% of the free nerve endings were located in the posterior layer of the thoracolumbar fascia. And the fascia has a lot of deep sensory innervation. So what did we say before about motor control? It's sensory information, correct? So the authors considered thoracolumbar fascia an important link in nonspecific low back pain. Nonspecific low back pain means they have no freaking idea why your back hurts. So now you're going to be able to see how the thoracolumbar fascia will be tied to that. And he also talked about the lift, the lumbar interfascial triangle. That's the one you saw on the cadaver. And what's really cool is, look at this one here, is that the clinical relevance emerging from the awareness of the thoracolumbar fascia and lift are their multiple attachments relates to their junctional coordinating functions. Coordinating functions, that's motor control, as pathways of force transmission, which is stability, to and from different areas of the body. So if you have it coming across with your knee to your hip, to your sacrum, to your lumbar spine, out the other side, we need to look at that interface. And they said here, the superficial fascia contains a dense presence of sensory mechanoreceptors such as Pacini receptors and Ruffini endings. So this is where the tape is going to come in handy because you're going to see a huge increase in motor control awareness, proprioceptive body awareness to your environment when we do tape and when we do soft tissue release. So Dr. Langevin did a really cool study on the thoracolumbar fascia shear strain in human chronic low back pain. You can find this on the internet, and this is something that we teach when we talk about rock tape. It says on the conclusion, the thoracolumbar fascia shear strain was 20% lower in human subjects with chronic low back pain. This reduction of shear plane motion may be due to abnormal trunk movement patterns and or intrinsic connective tissue pathology. So it's very cool. So what we want to do is we want to tap into that. And look at the picture here. She did some ultrasound of the thoracolumbar fascia of how it's moving. And you look at the left one, that's how well it moves with no low back pain. And on the right, you can see how it doesn't move so efficiently with low back pain. So which one looks more efficient for transmitting force? Which one would you like to have in relationship to being able to control force and strength? So this is why we want to go and open this area up with some of the work that we're going to do. Right? So let's talk about how we're going to fix this stuff now. So I think we can all agree that the thoracolumbar fascia is extremely important. Now I'm going to show you how I recommend that we fix it through the rail system, the release, activate, integrate, locomotion. So the release is going to be release soft tissue, release joint. Activate is going to be activate the sensory fibers in the skin, activate Chapman points. Integrate is going to be through synchronized movement of full body patterns. And then locomotion will be bigger patterns standing on 2 feet where you can now control cross body patterns. And the rail system encompasses 2 rails on a track, the conscious brain and the non-conscious brain. So we're going to tap into one, cueing you so you pay attention to what you do on one track. And then through the Chapman points and the tape, we're going to cue you into your non-conscious brain, getting synchronization and stimulation all the time from outside proprioceptive input, if that makes sense. Right? And you have to have both sides of the rail, otherwise you won't get anywhere. That's the key part. So let's do release. We're going to release the thoracolumbar fascia. You're going to see me here. I'm teaching it a course in London of my primal movement chains, and I'm using the rock blade ISTEM tool. So I'm going to be going over his thoracolumbar fascia here, and I'm going to talk about going over into the lat, into the glute. So with instrument-assisted soft tissue manipulation, you're going to make some changes to soft tissue, but really what we're seeing now is more of a neurosensory input where we're stimulating all these nerve endings to help your brain get a sense of decreased pain and discomfort, but also a sense of motor control and patterning. So there's really kind of a lot of research going on about how much we're really changing the quality of the tissue. I think that's still going to be expanding, but I personally think that we're going to be influencing both. So I'm going to let this play a little bit and you'll just hear me talk. Busy lumbar paraspinal. You got this guy is like, hey, I don't need to be here. I'm gone. All right. So that's a release 1. Then you could do, if you don't have that tool, you can do a release number 2. You can just take a foam roll, go over your entire mid back, your lat on either side, all the way down to your thoracolumbar fascia junction at the bottom of the rib cage. Then you can actually get some arching in here. And then what's not represented is some torque, where I would actually sit back up like this on the top left. And then I would try to bring my elbow on one side towards my hip on the same side, like you're side bending in the frontal plane. Go right, go left, go right, go left. And then what that'll do is that'll twist across the middle of the thoracolumbar fascia region, almost like you're trying to twist up a towel. So that's a really great way to dig in there as well. And I would do that foam rolling for approximately 2 to 3 minutes. And I do recommend that you support your neck. Then we can get some mobility in the T-spine. So a lot of times you'll have decreased mobility in your thoracic spine or your hip. So here's just one option to get some nice thoracic spine mobility. This is one from webexercises.com, but you can kind of choose any one that you want, or you can do it manually. And then now I'm going to be doing some activation. So activation for me is going to be some tape and Chapman points. So this one I'm doing a Big Daddy piece of rock tape. It's a 4-inch piece of tape that's going right across the thoracolumbar fascia. So it's going to give a lift up to this fascia. Remember we showed you how it wasn't shearing across in the Langevin ultrasound study. So that one I want to give a little bit of a lift. And think about the amount of nerve endings that are being stimulated here by the sensory input touch of the tape from the mechanoreceptors, the Pacini corpuscles, and the Ruffini ones. That's really what I'm tapping in through here to bridge force transmission from shoulder to glute on either side. And then we've got one where we can go a little bit more in depth. So the difference between here is that this one you can see we've got the one that I showed you from the other page But now we can connect glute to lat with a single piece across either side, so it's following the line of the fascia. The reason you would use this one as opposed to just this black one is because I had more inability to control the slings. I had more inhibition in the lat and the glute, and I just needed more proprioceptive input. Or the more tape you have, the more stable you are. So maybe you just need a lot more proprioceptive feedback than somebody who just needs the black. So then we're going to do activation points. We're going to activate the Chapman points for the lat and the glute. So remember, the Chapman point for your lat is going to be between ribs 7 and 8 on the anterior part of your rib cage. So you go from the bottom of the rib cage in line with your nipple, and you come up 2 ribs between ribs 7 and 8. Do the left, do the right, and rub in there for 2 to 3 minutes. Then you're going to do right up behind the angle of the jaw here. So you come right behind the bottom of the lobe of your ear and push up and forward, and you do both sides. That's going to be an extremely tender point behind near the angle of your jaw. That's going to be your glute max point, number 1. So do both sides. And then number 2 for the glute is all along the entire back ridge of the head. So just rub along and stimulate along the whole back margin of your suboccipitals and head and neck. You do that for 2 to 3 minutes. So that's release. We've done activate, and then now we're going to integrate. So I'm going to integrate into a rolling pattern. I'm going to do anterior and I'm going to do posterior. I would probably gear more towards posterior, but I'm going to show you either one. So you can also reference my rolling webinar that's under one of the webinars that we've done in the past. So here you're going to see me doing rolling pattern. So I'm doing the anterior oblique sling on the left, and then I'm going to do the posterior oblique sling on the left. Then I'm going to do anterior oblique sling on the right, going from shoulder to thigh. And then I'm going to be doing posterior oblique sling on the right. And that's initiating from above. And then we're going to do lower body. So now I'm going to do left leg. So that's going to be the right anterior oblique subsystem. So remember, we still name it by the shoulder. And then now I'm doing what? The right posterior oblique subsystem, even though I'm leading with the left glute. That's right anterior oblique. So I name it by the, left anterior oblique. And now that's right, this left posterior oblique. So you see how even I get confused? So I'll redo it again. Watch. See? So we're going to name it. Remember, we name it by the shoulder. So I'm going to be moving the left leg, but as part of the right shoulder complex coming down. So it's going to be the right anterior oblique subsystem. Okay, and then I'm going to use this glute here, okay, and then it's going to be what? The right posterior oblique. Now I'm going to do left leg, so it's going to be left anterior oblique. So we name it by the shoulder. And then now we're going to do left posterior oblique. And see how it's going to work that sling. Right? Do about 4 rolls on either side. Then I can do a prone stability pushback. This is one that I like, where I take a 2-inch band, I lock it around the thoracolumbar fascia. I usually have it on skin, not over shirt. Then I anchor a band low, and then all I do is get in a quadruped position where hands are below the shoulders, knees are below the hips, ankles and toes are dorsiflexed. And then all I'm going to do is keep my neck in neutral and push straight back to my heels, and it's going to give a nice pull on the fascia. It's going to lock in my inner cylinder. So what you'll do is you'll have your transversus abdominis, you'll lock in your pelvic floor, you're going to control your breathing, and it'll pull this down to really lock in the thoracolumbar fascia. I'm going to have a nice activation of lat to glute here. So it's slowly push back and hold for 4 seconds, and that would slowly come forward, and I would repeat that about 10 times. Then I can get up into loaded progressions. So this one, I'm in a tall kneeling position on both knees, and I'm going to anchor an elastic band. I like the elastic band because I have to control all phases of the movement, from concentric, which is where you're making a muscle shorter, isometric, where you hold it, and eccentric, where you're elongating the muscle. So now I'm in a concentric phase of my right lat. So here I'm actually working my right posterior oblique subsystem because I'm pulling my right arm coming across. Then I would do 10 repetitions, and then I would switch hands and do 10 repetitions on the other side. Now I'm getting into a stagger stance, or what's called a half kneeling actually. So I've got one knee down, one foot forward, and I'm working the left posterior oblique subsystem, left lat towards right glute. And I'm going to keep my body in line, so I have to have stability in the left hip and also be able to generate power from here. So I'm going to do 10 repetitions left, then I'm going to actually switch my feet and switch my hand to the right and do 10 repetitions on the right. You can also do as another variation, you can pull two at the same time, and you can do level changes. You can go high with the band, you can go middle, or you can go low. That's great because that mimics real life. Maybe you've got to pull something down low, like start a lawnmower. Maybe the middle one in through here, you've got to reach into something to the refrigerator, or high, maybe you've got to put a plate in or pull something down from above, or just throw your kid up in the air. So that's another way to do that. And then we come into the standing position, right? Athletic stance. Same thing, slight bend in the knee, athletic stance, bare feet, pull. So it's right posterior oblique subsystem, 10 right, 10 left. And then I can stagger stance now. So now I can generate more power and more pull. So this is like almost starting a lawnmower, right? So it's left posterior oblique subsystem, left lat to right glute, 10 here, then switch to do 10 on the other side. Then I can do one that's dynamic. So now I'm actually standing on my left and I'm lunging backwards. And then as I put my foot down, then I'm pulling the band back at the same time. So I have to control movement, control momentum, control eccentric and eccentric, acceleration, deceleration, and I'm working the right posterior oblique sling. Then I'm going to switch hands and just switch feet as I lunge backwards. And then we do locomotion. So those were all part of what? Integration. And now this is L. Locomotion is movement. So this is the one that I've showed you before with the fall matrix. But this is what I would do now. But what I would do is probably take my left arm and put it across on my right knee. And then I'm just going to go down to my ground, lie on my back. Go down to the ground, lie on my stomach. Then I'm going to go down to the ground, lie on my left side. Go down to the ground, lie on my right side. And then I would switch hands and do the same thing on the other side. And just go through that matrix one time. So you can see how easy that is, right? So what now? Well, what now is I want you to go back and do this for yourself first so you can see and feel the difference. I want you to think about and pick one patient or client that you could begin to do this with who has discomfort or pain in their body that has not responded, particularly something in the extremities. Or if somebody's been able to not been able to generate strength and power through a workout, you're going to go through this matrix of them. And through all those correctives, you don't have to do every single one of those correctives. Just start with one or two in the beginning of the movements and then work your way up. And then you can progress through them when you can own them and control your breathing and do that. I also would like you to write down something that was most useful for you, that you can do this for sure. You can start doing at least just one thing in the matrix that we went through. You can also go and order my book, Stop Chasing Pain, on Amazon. It's available for pre-sale if you haven't done that already. And of course, if you guys are seeing this, you are already part of the GoPro that's on there. But I really do am thankful for you guys on tuning in to what we just did. And remember, we always want to get to the why of something. And for me, the why is what's the brain trying to accomplish by restricting movement? To me, it's stability and safety. And through the rail system, through these rails, through the conscious and non-conscious, you'll be able to tap these in and always do it in this particular order. Release, activate through Chapman, through tape if you can do it. Integrate through synchronized movements, full body, not isolated movement. And then locomotion, challenging gravity, going down and getting up again. All right, so have at it. Go say, change some lives, and hopefully you will also too now say that the thoracolumbar fascia is your favorite fascia in the body.